We are back to our show again. Good morning, Kuwait. We're moving for our interview segment. We're talking about a healthy smile is not only a reflection of beauty, but also an important indicator of oral health and proper function. Orthodontics and dentofacial orthopedics are a specialized field that play a vital role in correcting bite problems, improving chewing and breathing functions, and enhancing both self-confidence and the quality of life. Today, we are pleased to have with us today this morning Dr. Fadel Alalawi. He's a specialist in the orthodontics and dentofacial orthopedics. So to discuss the latest advancement in the orthodontic treatment, address common misconception, and answer some of the most frequently asked questions regarding the types, and even the health benefits and orthodontic care. Hello, doctor, and good morning.
Good morning.
You're most welcome. Thank you so much for joining us on our show. Good morning, Kuwait. Doctor, we are very pleased today. We are very appreciate you are with us today in the studio. In the beginning, we spoke in the off-air about orthodontics, and we spoke about different kind of facts. We're gonna elaborate more in the show.
Sure.
But what is the importance for orthodontics we call it in the care and also in the healthcare, despite also the cosmetic way? What do you want to say?
Orthodontics, it's the smile, where it gives the confidence for the patient, and it boosts his life. Usually in the state, most of patients, if they come, they ask for, we want to get more income after treated our smile. Smile is the confidence.
Continue, doctor. Continue, doctor. Continue.
Smile is the continuation of healthy mouth, affected of germs, everything. We should get rid of it. And smile also give the appearance of the person.
And also you mentioned something important, doctor. The smile gives the appearance and the confidence of the person. Today, you know, usually this time happening in any show, people are like doing something in the backstage. We are in the face. So every time you are the reason who make us more confident. We are in the face of everything, doctor. But this is for the healthcare. Cosmetic is important also, doctor. You've been with the too many kind of different celebrities in the Kingdom of Bahrain. So when what is the most common things happening to you when any patients, especially presenters, are visiting your clinics?
Usually, earlier I used to do different diagnosis, but now we do the holistic diagnosis. We go for health, body weight, posture, tongue posture, breathing, sleeping, all these things we have to focus on it to give better health for the patient.
You mentioned something important, doctor. Also, we check the sleeping behavior. Is it? I know there is a link between orthodontics and sleeping disorder now. It's important?
It's very important because obstructive sleep apnea, which is sleep disorder, it causes heart problems and diabetes. That is approved. Sleeping means the brain will not go to deep sleep. There are 4 stages of a sleep.
Okay.
One is the light, one is where our eyes be moving. The other stage is REM sleep and deep sleep.
Okay.
Most of people, they sleep light sleep. They can hear everything and they can feel everything while sleeping. The most important is REM, which we get dreams on it. And the other stage, which is deep sleep. Deep sleep is the hormones.
Okay.
It's the repair for the body and the immune system.
Nice. It's repair for the body and for the immune system. So it's like, that's why we know now that the most important we learned from this episode, the oral health is important. It's links between orthodontics and even better for our health. But how is it important, doctor, to have like a daily basis or maybe monthly consultation with orthodontics doctor?
It's could be once a year.
Here, okay.
A year. Most thing for the kids right now. We have 10% of the kids from birth, they have got narrow airway where they can't breathe well, and they're suffering from obstructive sleep apnea. Good that you have in Kuwait sleep hospital, which provide the treatment for them. I've got so many referrals from them for sleep apnea kids. They have narrow airway, mouth breather. We call them adenoid face.
Adenoid face.
So the cheek will be dropping with the gum appearance while smiling, receded chin, dropping shoulder for the kids, head forward. Like they said in the conference, kids in the body of adult, aged people.
Nice.
So if they start their age with aged person, so once they grown up, they'll be facing a lots of medical problems. But once we treat the treatment, sometimes we treat 3 years kids with expansion to get more room for the tongue, so the tongue won't be on the airway, it will be on the mouth.
In the mouth.
And instead of being the tongue in the floor of the mouth, it should be on the roof of the mouth. That will open the airway and will improve the health of the kid.
And also in addition, doctor, you mentioned different kind of children ages, 3, 6, and even teenagers. How about the ideal age for the people who have to take a treatment from orthodontics?
The treatment age, according to orthodontics, it's 6 to 10. But
6
nowadays, because of sleep apnea, everything is changed.
Okay, and this is because of the sleep, everything is changed. Now let's go about different kind. Improper bite, like like these days, especially for the kids.
It's a good question. Improper bite, like let's say underbite, it changed the posture of the kids. Cross bite might give scoliosis for the spine. Narrow airway, it will bring the face forward, so the balance of the body will be standing on the toes, knee, lower back, shoulder, C1, and the head.
Nice. We see the pictures, you can see it in the 3 boxes. It's about how the orthodontics comfort the patients, like in a very funny way, especially the children. How is it important, doctor, like every time when a patient enter the clinic to comfort them and convey them?
Some of the patients, their parents have done the most important work.
Okay.
Some of them is difficult. And I used to treat them even with difficult cases, uncooperative patients, kids especially, because for his health.
His health.
Because they cannot sleep, and if they don't sleep, they don't have immune system. And most of kids who have the problems of airway or sleep problem, they cannot sleep alone in their room. They have to go to their parents. They need they need hug from the parents to give them more secure comfort because they have nightmares due to blockage of air. So we have to take care of this type of kids to give them better life.
Better life. Even this is important from you, doctor. From your responsibility. When any patient enters the clinic, you will know them that they did their own homework, or
yes.
maybe you have to do your own.
Yes.
This like any stories you want to mention to us about one patient came to you in a very stressed mood and you comforted him, and his result is amazing.
I had a patient, kid.
Okay.
First time when we took the impression to do the appliance for him, it was very difficult, even though his mom have done a great job for him. We took the impression, we fit it. It's difficult for him to cooperate. After 2 months, he comes and said he's so happy, and when he lost his appliance, he was regret that he lost it because he missed the comfort.
Nice. It's amazing, doctor. Even the way when you mention about the patient, it feels something about from your heart. You've been with different kinds of patients and etc. Now we'll move about different topic. We'll talk about the traditional braces and aligners. I know this kind of thing, especially for the kids, is different from the adults. What do you want to elaborate for this topic?
In metal braces or traditional braces, there are 2 types. One is the traditional one, which we use the elastics to hold the wire. The other one is self-ligating, where there's no elastics. It have got slot, fix the wire. There are a big difference between the traditional and self-ligating. I prefer self-ligating because we don't need to extract, remove teeth. It will do expansion for the upper and lower jaw. It will help the airway. It will enhance the beauty of the patient because it gives him better facial lift. The aligner, or most of patients, they know it as Invisalign. Invisalign is the mother company of aligner.
Aligner, yes.
There are so many different companies now in the market. Aligner, it depends on the doctor treatment plan.
Okay.
It could be same doctor, same company, give different treatment for each patient because it depends on the need of whether health or teeth.
Okay.
I prefer health because it do everything for the patient.
Nice. Everything for the patient. Sometimes orthodontic treatment have a negative effect for the oral health. It depends about bad consultation, doctor, or it depends about the patient as well?
Most of the problem is it depends on the patient awareness. Sometimes they fed up from brushing. They don't have time to give for their health. And poor oral hygiene, it causes bone loss, recession of the teeth, gum. So that will cause problems for the patients. And they have to consult or periodontia every 6 months.
Nice. So this is like about the most important, the patient have to take good care of themselves all the time. For sure, when they open their mouth, you will know they are doing good or they are doing bad. Sometimes maybe something funny jokes happen between the patient and also the doctor. Like he said, yeah, I did it, and you will see the result is so bad.
Yes, that's always.
That's always. But how you comfort them all the time? You will find that they didn't tell the truth. You're make it between, or you have to say that.
I just let it go.
Let it go.
I explained to him again that oral hygiene, then I'll let it go because I know most of them, they do the same thing.
The same thing.
Right.
So doctor, this gave us a different kind of topic, like what is the collaboration between orthodontics and also the oral surgeons? Is it like there is some kind of links between them?
There is a orthosurgeon.
Orthosurgeons.
Yes. So for adults who have got receded chin or underbite or crossbite, that we cannot treat it with braces.
Okay.
So we have to refer to join the clinic with the surgeon, so they have to do the surgery part. And nowadays they do MMA, mandibular and maxillary advancement for patients who have got sleep apnea.
Okay.
Because to treat the airway, because sleep apnea, it's the heart problem, it's diabetes, it's most of the diseases sleep apnea.
Sleep apnea, it causes too many different kind of diseases for any age, doctor.
For any age.
For any age. Now we'll talk about the crowded teeth. Like you will see people, they take good care of their teeth and they are crowded. Is it like a crowded teeth, like have some problems for the oral, for the hygiene also?
Yes, definitely. Crowded teeth, it will not help patients to clean their teeth, accumulations of calculus. It will lose the bone, gum. Crowded teeth will give a clinching to the patient, so it might fracture the enamel of the teeth. Crowded teeth or poor oral hygiene, like nowadays they talk about Alzheimer. The bacteria which they found in the gum, it might cause Alzheimer with the brain.
Really?
Yes.
It's a new research?
It's let's say new research. At the same time, the plaque which is on the mouth, it goes to the veins. So it's block the veins.
Block the veins. This is most important. And also, doctor, like you mentioned something important. Like this is like now the new research shows that sometimes maybe the problems in the gums and the teeth cause Alzheimer because it will affect the veins. But even how can us as a patient, if I take good care of my teeth and I go in the treatment, also be attention for your instructions, how does it cause me in the future basis? I will be better.
You'll save your life from problems.
Saving my life from the problems.
Yes.
So that's why, doctor, before we end the topic, you have any last words you want to say for the people who's watching us now, especially the pure patients?
Yeah. I'd like to talk about the temporomandibular joint, the joint of the jaw. It causes headache, which is migraine sometimes, neck pain, shoulder pain, lower back pain, insomnia. It reduces the efficiency of breathing while sleeping. It's break the sleep every 2 hours. Patients who have got these problems, they have visited so many hospitals just for diagnosis, and usually every treatment or every diagnosis will be negative. They don't have anything.
Amazing, Doctor. We are very appreciate your time being with us today in the studio. On behalf of our show, Good Morning Kuwait, we want to say thank you so much. Thank you so much for joining us today.
I'm glad to be here.
You're most welcome. Thank you so much for joining us. Special thanks and appreciation for our distinguished guest, Dr. Fadel Alalawi. He is orthodontic specialist. Now let's go to this tiny break, then we'll continue with show Good Morning Kuwait. So please stay tuned.